Hi, I'm Adam Hargreaves.
And I'm Eleanor.doolin, and we're both specialist recruiters within the IVD space. And today we're going to talk to you about CRISPR as part of our series on innovation in diagnostics.
CRISPR is one of the most exciting areas of innovation across the whole life science market and a hot topic within diagnostics.
But it's complicated stuff. So as we spoke with Ishani, our gene editing expert, to tell us more about CRISPR and the science behind it.
So every cell in our body contains a copy of the genome. So genes are made up of DNA, which essentially contains the information of what we are. It defines how we look and it affects our health. And over time, researchers have actually shown that defects in these genes can lead to various diseases. So if we could find a tool to correct these genes so that they are no longer disease causing, then that would be very useful. And that is where CRISPR comes into play. So CRISPR technology basically allows us to make changes in the DNA so that it has the potential to cure genetic diseases.
We're only just scratching the surface of what's possible within CRISPR. I spoke with Bill Standwill, Head of Commercial Operations from Sherlock Biosciences, to run through the potential benefits of CRISPR within diagnostics.
Yeah, so it's definitely, it's a low cost. It uses a lot of general reagents that are available, so you have an easy supply chain scale up. It's rapid. There's some data out there, some white papers and stuff showing, 5,000-10,000 results per day. It's instrument agnostic somewhat. I mean, there's a couple of things that you need, but you don't really need to scale up with the large instruments. You don't have to tie to it. And I think it's the ability to really very quickly, it's a programmable technology. So you can go from, okay, here's a sequence, here's what I'm looking for, to start creating some beta probes and starting to look at detection.
Okay.
One of the things that's come up the most with the COVID testing, which is interesting, is the exquisite specificity, the ability to call a negative. And in areas where you really need to know that information, it's become really exciting. So one of the areas that you hear some talk about is in the airports, right? Or areas where they're trying to control incoming and outgoing infectious disease.
So, who's involved? In diagnostics, it's a two-horse race between Sherlock and Mammoth Biosciences.
Both of these companies are fighting to transform diagnostic testing using CRISPR.
Infectious disease, agriculture and oncology are just some of the applications they're focusing on. That's not to say other companies aren't getting involved. LATAM-based Casper Diagnostics are also making moves in the market.
As with any exciting technology, funding and recognition follow. Jennifer Downer, who co-founded Mammoth, even won the 2020 Nobel Prize for Chemistry. This is thought of as science's ultimate prize. There are hurdles facing the widespread adoption of CRISPR though. Funding and FDA approvals are the main obstacles that companies in the space will be looking to overcome. Here's
Bill with a little bit more context on that.
I think it's always, the headwinds, as I mentioned earlier, are always there. So the one thing that I've always looked at as I've launched technologies, if a lot of people are talking about it and there's a lot of headwind, it usually means there's something there, as opposed to if people kind of dismiss it. And with CRISPR, we see quite a lot of lively discussion around it on its pros and cons. So we'll know, right? It's out in the clinical world. We're going to start. There'll be a lot of data generated, a lot of papers coming out, so people will really know how it performs.
Obviously, a long way to go and lots of innovation to come, but we're excited to watch this journey.
We hope that you've enjoyed our look into CRISPR, one of the most innovative and exciting areas within our diagnostic space.
Our thanks go to Bill and Ishani for taking part in today's video, and if you've got anything you want to discuss, please get in touch.